Welcome back. In this video, we'll talk about the symptoms, the causes, and the treatment of ectopic pregnancy. Ectopic pregnancy is defined as having implantation anywhere outside the uterus. The implantation mostly occurs in the narrowest portion of the fallopian tube, which is the ampulla. And it makes sense because as the egg moves from the ovary to the uterus, sometimes it gets stuck in the ampulla. Other causes that narrows down the tube will also cause implantation in this area, for example, scars or infections, or of course, previous history of ectopic pregnancy. So think of anything that would prevent the egg from moving to the uterus. It is very commonly confused with appendicitis because of the location and the pain. The hallmark is pain and bleeding during the first trimester. Another very common presentation is that a patient don't know that they're pregnant in the first place, and then they present with amenorrhea and lower abdominal pain. That should be an immediate red flag for ectopic pregnancy. The first test to order is HCG levels, and if it was high, then this patient is most likely to have ectopic pregnancy. You can confirm the diagnosis with ultrasound. Kartagener syndrome also puts the patient at risk of ectopic pregnancy because in this syndrome, the patient have dysfunctional cilia, so they cannot effectively move the ova from the ovary to the uterus. And of course, this results in ectopic pregnancy. We treat it using methotrexate, especially if it was less than 6 weeks of gestation. And the efficacy can be increased when used with misoprostol. Anything more than 6 weeks or anything that is too large, we use surgery to simply take out the entire fallopian tube along with the ectopic pregnancy. Very rarely do we just take out the ectopic pregnancy without taking the tube. And here's a small quiz. Which of the following is a known side effect of methotrexate? And here is the answer. Alright guys, that's all I have. Thank you so much for watching and hopefully this helps.